More than 34 million Americans have type 2 diabetes, with another 88 million with prediabetes. Currently, 1 in 4 healthcare dollars is spent on diabetes care or prevention. Early identification of individuals at risk for type 2 diabetes enables prevention. Dynasty Medical Laboratory Services has created a leading diabetes test panel, MDDiabetic Pro. This robust panel combines key markers for disease progression with an optional genetic risk assessment to get a complete picture of each patient's health and customize a treatment plan accordingly. The MDDiabetic Pro panel entails a prediabetes diabetes test panel, which categorizes tests by functional categories: glycemic control, insulin resistance, beta cell function, and cardiovascular and renal comorbidity assessment, with an optional genetic risk test, Diabetes Predict. Reports are color-coded, making it easy for patients to understand. The report categorizes the results into risk categories or into a normal-abnormal category. The second component of MDDiabetic Pro is a genetic risk assessment, Diabetes Predict. Diabetes Predict is a predictive genetic test which enables healthcare providers to discover a patient's genetic predisposition and that of their family who suffer from type 2 diabetes with a simple cheek swab test, prevent type 2 diabetes from happening by following specific lifestyle recommendations, nutrient suggestions, and recommended diets based on DNA results, and use tools which help prevent type 2 diabetes for those at medium or high risk. Diabetes Predict is an advanced genotyping tool for type 2 diabetes risk assessment, analyzing 16 SNPs in 16 genes. This test analyzes the main genetic variants or polymorphisms associated with type 2 diabetes, taking into account associations with multiple ethnicities. This test is used clinically to identify patients who are at high risk of developing type 2 diabetes, as extra motivation and additional information based upon genotype to implement and adhere to behavior intervention measures such as diet, physical exercise, and lifestyle changes, and family cascade to enable early intervention. Diabetes Predict is recommended for high-risk patients, including overweight and obese patients with a BMI greater than 25, or children whose BMI is in the 85th percentile or greater, patients with a sedentary lifestyle, high blood sugar, elevated A1C, those who have a family history of type 2 diabetes, patients with a personal history of gestational diabetes, or for type 2 diabetes patients as an index case for family cascade intervention. The test will detect a patient's genetic risk of suffering from type 2 diabetes. This is shown in an easy-to-read report indicating whether the patient's risk is high, medium, or low. Diabetes is a multifactorial disease where the genetic component is important. This genetic test, as part of MDDiabetic Pro, was developed after careful examination of extensive population studies of the genome of diabetics, which identified genetic polymorphisms present in people who develop type 2 diabetes. Of the 16 genetic variants, 13 are associated with impaired insulin secretion, and the other 3 related to insulin resistance. Once a high genetic risk has been detected, measures can be taken and other factors can be controlled to prevent type 2 diabetes. The report will include treatment recommendations, including specific diet and lifestyle modifications individualized by the patient's specific genetic variant.